Hello and welcome to today's webinar. We're very pleased to have you here today. Just give it a moment while everyone gets logged in. Thank you all so much for joining us today. Our webinar will be beginning soon, but in the meantime, I'd love to make some general announcements. Next Wednesday on October 21st, we've partnered with the Midwest Center for Occupational Health and Safety Education and Research Center at the University of Minnesota to offer a free webinar on Minnesota's Safe Patient Handling Act, Policy, Practice, and Research. On Wednesday, November 4th, Anthony Nardone at UC Berkeley UCSF will be presenting on his research on historical redlining and health outcomes. Our next industrial hygiene webinar will be on Tuesday, November 10th with Dr. John Reichard on biomonitoring and risk assessment, essential concepts and emerging technology in partnership with the University of Cincinnati Education and Research Center. For more information, you can visit us at coeh@berkeley.edu/aboutce. And on behalf of education and research centers throughout the country, we're pleased to present the Industrial Hygiene Webinar Series, offering free webinars the second Tuesday of each month. This collaborative effort is on behalf of each ERC's continuing education program and aspires to provide access to current research supported through NIOSH ERC programs. Thank you so much for joining us today. Today's webinar on heat stress management in 2020 is brought to you by the Sunshine Education and Research Center and Dr. Thomas Bernard. A few housekeeping items first. You are going to be muted during this presentation. If you would like to ask a question, please enter it into the online Q&A. We'll save time at the end of the presentation to address all questions. All participants who logged in today with their registration email for the full live presentation will receive a link to the recording and an evaluation form tomorrow at 12 p.m. Pacific. This evaluation will qualify participants for a certificate of completion worth 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. This presentation is being recorded and will be made available on the COEH Northern California's YouTube page and on our website. At this time, it's my pleasure to welcome our presenter. Thomas Bernard, PhD, CIH, is a professor in the University of South Florida's College of Public Health and director of Sunshine ERC. He teaches in the Occupational Exposure Science program. His interests in heat stress include exposure assessment, the effects of clothing, psychological monitoring, and personal cooling. He's helped develop heat stress management programs for a variety of occupations. He also would like to thank the ISO Working Group on Thermal Environments and the ACGIH Physical Agents TLV Committee for this opportunity to influence professional practice in heat stress exposure assessment. Thank you so much for joining us today, Dr. Bernard.
It's a pleasure indeed. Thank you for the introduction. And I'm happy for all of you that are joining us live. I was pretty certain that the competition with the Apple event and Amazon Prime was going to perhaps slow us down a little bit. I created the title Heat Stress Management in 2020. I don't know, 9 months or so ago. So, and what this does reflect is kind of what I'm thinking today. As I go into this, there's a few warnings. So first of all, an acknowledgement. My employers of the University of South Florida for the last 31 years, and I'm deeply appreciative of that opportunity to serve. A colleague of over 20 years is Candy Ashley. Much of what I have to say from data at USF wouldn't be possible without her. Of course, NIOSH has been incredibly helpful to us. First of all, supporting the Sunshine Education and Research Center. And I want to just announce that this is at the University of South Florida, as well as involvement with the University of Central Florida and Embry-Riddle Aeronautical University. So it's truly a collaborative center, and we think that opportunity is great. And then I've had the opportunity often to meet with the other NIOSH supported centers, and I think all of them are wonderful and a great contribution to occupational health, safety, and wellness. And then, of course, I want to acknowledge the direct research support that NIOSH has provided me and others in the center. And in addition to NIOSH, we've had a number of other sponsors of our research in heat stress and also in the practice of heat stress management. And as Michelle mentioned, I do appreciate the opportunity to have the platforms from the ACGIH and the ISO. And then wrapping all of that up by saying, I don't represent any of these people, and they would deny that any of my opinions are shared by them. So you really have to take what I have to say with a grain of salt and a great deal of professional judgment and caution as you might go forward with the information I'm going to give in the seminar. So I was thinking about this a bit, and I thought, well, geez, you know, I've been reading now, you know, the newspapers and on the internet and other areas, and I'm beginning to recognize what clickbait looks like. And so this is 4 astonishing or amazing things about heat stress that's going to behoove you to pay attention over the next 40 minutes or so. I'm going to start with just some things about heat stress assessment. I'm hoping that some of this is novel, and I'm also hoping that some of this is just laying the groundwork for what you already know. An area where I'm just kind of mentally pushing an envelope to see who pushes back and how is establishing the idea of risk associated with exposures above the occupational exposure limit. Testing the water with new ways of describing acclimatization. And then I want to wrap up again with a more traditional pitch about the need for monitoring signs and symptoms, and then first aid and emergency response to heat-related disorders. So in terms of heat stress assessment, this is kind of the background on the standard stuff. I will spend most of the time on WBGT. An alternative rational index is predicted heat strain from ISO, and I want to introduce that to the audience. So the WBGT-based exposure limits have been with us for the better part of 60 years in some fashion or another. I want to hit on the premise as well as talk a bit about the performance of these in terms of protection. So I start with the premise, and in the introduction to the most recent criteria document for exposure to heat and hot environments, the Occupational Safety and Health Act is mentioned, and it reminds the readers that NIOSH is there to recommend limits that include but not limited to exposures to which no worker will suffer diminished health, functional capacity, or life expectancy as a result of their work. And the note here is where heat stress is. It really looks at this idea of diminished functional capacity as the basis for the standard. Sorry, got ahead of myself by 1. So the history of the current OEL actually dates from 1963, and the influence that these have is kind of amazing if you consider that this standard that we use was based on this one paper that had 2 subjects for all of the exposures and then 1 subject extra for the principal exposure. So it's basically based on 2 to 3 people. But Lynn's observation was really very critical. And what he did is exposed people to 1 hour of heat at various levels, and they're indicated here. And notice that they come up in 40 minutes or so, reach an equilibrium and stay flat and cluster. And then with a little bit higher level, they reach an equilibrium core temperature a little bit higher, and then with higher heat, a higher level. He retranslated his data into a chart that looked like this, so that the temperature scale and effective temperature and WBGT are very close. You can see that there's a region of environments for any one of these 3 workloads where the core temperature response is really relatively constant. And then there's a point where it begins to inflect upwards. So this is the work-driven zone, and this is the environmentally driven zone. And Lynn thought, well, geez, if we limit everybody to the work-driven zone, that kind of maximizes protection. So that was his idea of a prescriptive limit, or specifically the upper limit of the prescriptive zone. He went back in 3 other papers and explored this idea of an upper limit of the prescriptive zone as an OEL. He did one where he took 100 participants, divided them into 25 groups of 25 at different exposure levels, and really demonstrated the upper limit worked well. And then he looked at continuous and intermittent work, which is really then the basis for using time-weighted averaging, and demonstrated that in fact it works. It doesn't matter much whether the work is continuous or whether there's 30 minutes of work and 30 minutes of rest. And then the other is that he looked at younger and older wasn't terribly old, and saw that the only time that there was a differentiation in the age is when you were above the upper limit of the prescriptive zone. So these studies collectively were convincing that this should work well. Another set of studies that followed shortly thereafter that don't get nearly the attention of Lynn's studies were some by Kohlmeier and his colleagues at UAB. And basically his task was to go back and demonstrate that the occupational exposure limit, or the upper limit of the prescriptive zone, was good. And as you can see, for acceptable exposures, they're down below, and for unacceptable exposures, they're above. So within the limits of the way they did their studies, that seemed to reinforce the exposure limits. And then the question is that these subjects were a mix of acclimatized and unacclimatized. How do you begin to get them so that the reference point is an acclimatized group? And there were studies at the time at the University of Pittsburgh and out of South Africa that indicated that the difference between acclimatized and unacclimatized was about 2 to 3 degrees CWBGT. We went back and looked at Kohlmeier's data in a little bit of a different way, and he had subjects that were very clearly as unacclimatized as you were going to get, in that they were worked in thermally neutral or cold industries and wintertime in Alabama when these tests were done, as opposed to as climatized subjects which worked in hot industries in the summer in Alabama. So I think that 3 degrees C is a pretty good reference point for where a thoroughly unacclimatized to an acclimatized person would be. NIOSH investigators in the 70s gathered this data together, felt that there was a little bit less risk at lower metabolic rates, so that they differentiated a little bit less, and that there was greater difference at the higher work rates. So they then determined that they had a recommended exposure limit that followed the solid line, and then this a little bit of a steadily increasing difference for the action limit, which is really fundamentally the unacclimatized line here. And as you would expect, as the internal heat generation increases, the environment has to better facilitate that loss of heat through evaporative cooling, and that's reflected in lower WBGTs. So the exposure limit really has good face validity and has a reasonable science behind it. We at USF, with a student and a postdoctoral fellow from Ecuador, again, Candy, Ashley, and I went back and looked at the exposure response curve for sustainable exposures in our data. And the other thing that we noticed was that there was a clear loss of thermal regulation that resulted in an increase in body core temperature, rectal temperature by 1 degree C an hour, just 3 degrees C above the sustainable level for any individual participant. And at 1 degree C per hour, that's really a very substantially high increase in body core temperature or heat storage, and that would represent an alarming increase if we were to see that in the laboratory or in the field. So looking at the data over 3 different metabolic rates, 3 different levels of humidity, we found, in fact, an exposure response curve right at that threshold of being able to just barely maintain thermal equilibrium, such that at the recommended exposure limiter, the TLV, so the OEL, is that we get about a 1% probability of being unsustainable. And as you would then expect from any good public health model, most of the exposures then would occur substantially, that those transition points would occur substantially above the limit that we use. Going back and looking at the data from one Lin study where we can pull that information out, and the Kohlmeier data, they both showed very good sensitivity and reasonably high specificity. The USF studies indicated, again, high sensitivity, but the specificity was much lower. And I think this is due to the fact that we had different spreads in of the data away from the decision point. And the USF crammed that data closer to the decision point so that there were more false readings than the other two were able to see. So in conclusion, for WBGT-based occupational exposure limits, reflected in the REL, the TLV, and by the way, the ISO, we do have high sensitivity. We have very low specificity, which means that there is a high rate of false positives. Always a concern for false positives because you begin to lose face validity. You couple that with the fact that serious exertional heat injuries or compensable injuries are relatively rare, and depending upon the different sources of data, they probably range somewhere from 20 to 200 cases per 100,000 FTE during summer months. So we don't have a lot of precision in zeroing in on exactly that temperature when we look at these incident rates, but they do point to relatively rare events. But the odds of becoming unsustainable once we start moving up are somewhere between 2 and 2.5 per degree CWBGT. So that it doesn't take long to start getting noticeably higher odds or probabilities that it will be unsustainable. And as I'll mention in a few minutes, that then moving into that extreme level. So this really is the major point that I wanted to make about the WBGT exposures. or exposures based on WBGT assessment. Predicted heat strain is one of several, or actually many, but the predicted heat strain is a fairly widely accepted rational model for heat exposure. It's embodied in ISO 7933, and it's in its current stage about to be finalized. In its current form. So it's a rational method, so it uses a heat balance approach or a biophysics approach. The limits are based on a predicted rectal temperature and a predicted sweat loss. So the model is going to predict a physiological outcome and especially a limit. It includes the job risk factors of environment, metabolic rate, and clothing, but also includes a fourth, if you will, job risk factor, which is time. So if you work up to that time limit, it should still be acceptable. So you can work above a WBGT, a sustainable exposure limit over long periods of time, and yet have a time limit that leaves you relatively well protected. In terms of implementations, there are several out there. If you're going to use one that at least is based on the 2017 draft that might refer to a 2018 discussion document. And there is one available for downloading that works on Windows OS that is free to the use. I'm not yet, I think, ready to share mine, and that there's a little bit of tweaking that I want to do to it, and I want to bring it into the 2020 version before I release it out anywhere. But the PHS of in itself is a relatively complicated model, but it can be easily just treated as a black box. And there are really two questions we're going to ask of that black box. One is the kind of WBGT, is this exposure safe? Yes, no. And we'll see in a minute that it does a good job of that. And then the other is, how long can an exposure safely last? And what we're going to put into this black box is environment, metabolic rate, clothing information, and PHS allows for the introduction of acclimatization state and height and weight. I tend not to like to use personal factors like height and weight. So you'll see me present these data as fixed factors. And then from that, the black box will give you a decision or a recommendation. And that basically is a time limit. So when we look at how well PHS works for sustainable exposures, it has, again, good sensitivity and modest specificity for woven clothing. It wasn't validated for non-woven clothing, but in fact, we've run a range of non-woven clothing through this, and we find that it does a fairly good job of having adequate sensitivity and in fact, surprisingly good specificity. When we look at now that time-limited one, how good does it do at prescribing a time limit for, in this case, woven clothing and for fixed individual factors? So we use the fixed height and weight. We again see at the threshold value of a predicted core temperature of 38 that it's at about a 15% probability that it's wrong, that you got a false negative. But looking a little bit about the shape of the spline here is that given the inherent margins of safety that we put into the analysis, that works, I think, reasonably well, and you should be comfortable with it. looking at the same across all of the clothing ensembles. In fact, it gets a bit better with a 10% probability. And again, with that little bit of a protective niche in the lower end, we feel comfortable that PHS, in fact, serves the purpose that we want it to. All right. So that goes from what I don't think is anything terribly novel to now risk assessment. And basically it's asking some questions about sustainable heat stress exposures, excessive heat stress exposures, and then time limited exposures. These are now starting to move into the territory where I'm proposing them out. And in some regards, you're the first formal forum to hear them. And we're gonna, I think maybe with good feedback, start to tweak them into where they should be. So, but what's a good starting point? And that would be something that's, what's the upper limit of acceptable? And that's when the risk of an unsustainable heat stress is small for most healthy workers. We used as our basis moderate work, 300 watts, ordinary work clothing, and a healthy worker, and that healthy worker is unacclimatized. And that worker then is represented in terms of protection by the occupational exposure limit -3 degrees C WBGT. And then for our presumptive example of 300 watts, that'd be 25 degrees. So this would be the alert limit or the recommended alert limit or the action limit. Okay, and this has then a risk of a 1% probability of being unsustainable. So unsustainable, and I'll come back to this, doesn't mean that they're substantially at risk. It just means that they'll start storing heat for an unacclimatized worker. The other interesting thing, bringing in a data point from outside of this concept, is when you look for where there have been OSHA citations for heat stress, all of the OSHA citations are above this limit. So the OSHA has not been called into a case that would be in the acceptable zone. The next step then in following this thought process is a caution zone. And again, risk for unsustainable heat stress is small for healthy, now acclimatized workers. Again, the same baseline, 300 watts, ordinary work clothes, healthy worker, acclimatized. The occupational exposure limit would be 28 degrees C, WBGT. This has that 1% probability of being unsustainable with a gradual rise in heat storage for a healthy acclimatized worker, and about a 10% probability of being unsustainable for unacclimatized. So a little bit of a change in that profile. And then it would have about a 1% probability of being an excessive exposure for an unacclimatized person. So this excessive exposure, remembers that definition of a body core temperature rise on the order of 1 degree C per hour. Then to note from some of the epidemiological literature, workers' compensation claims for heat-related disorders start to increase in this zone. So they start in a caution zone and then go up from there. For moderate then is the risks are starting to, we're going to start talking about excessive risk, but we want them small. And remember, excessive risk is a high rate of heat storage. That would be the OEL plus 3 degrees C WBGT, or about 31. And for a reference point, if you were to do the time-weighted averaging, that would be about a 30-30 work-rest cycle with the rest in a similar environment. The risk is a 10% probability now for an acclimatized person to be unsustainable, and a 1% probability of an excessive exposure for an acclimatized person. Notice what happens with the unacclimatized is at this rate, we have about a 50% probability of being unsustainable for an acclimatized. So this starts not to be too surprising, with a 10% probability of being excessive for that unacclimatized person. Then high is where are they really just excessive heat stress for most healthy workers. And I suggest that that should be another increment of 3 degrees or an occupational exposure limit +6. And then this is really the limit for resting only. So if I were sitting in an environment at 34 degrees C WBGT, the TLV or the occupational exposure limit would say the only thing I could do for long periods of time is sit. So if that can give you a frame of reference. At that point, for the acclimatized, there's a 50% probability of unsustainable at that 300 watts and a 10% probability of being excessive, again, for acclimatized, and now really very high probabilities for the unacclimatized. So taking those and summarizing them in a nice color-coded table is that we have these heat stress levels, and for some of you, you may begin to recognize a similar color coding and similar kinds of notations that NIOSH and the National Weather Service use to describe heat stress levels. And I took that idea from them. Right now, with a heat index as an alternative, and I am supportive of that idea, but using the National Weather Service color codes, I think, is not a sound basis. From what I understand from people familiar with this in the National Weather Service, these color codings were arbitrary, and they have received some scrutiny in administrative law hearings now, and there's a little bit of caution about that color coding. But we've done some work, and it's been confirmed by OSHA investigators looking at heat index as an exposure limit. And for a crosswalk, we've published an equation that looks like this. And you would increase the heat index for direct sun. So if you had a heat index value, you were in direct sun, it really effectively would be 6 degrees higher. Or for a limit value, and you'd lower that the heat index threshold by 6 degrees F in order to account for the direct sun. And then following that, then we can create, again, a table that uses heat index, again, moderate work, ordinary clothing, direct sun. And these would be the heat index values that I begin to suggest would be appropriate for those work circumstances. Comparing them to the NIOSH values, NIOSH has nothing for acceptable, but 2 OSHA studies would suggest either 80 or 85 degrees below those as being acceptable. Their most recent papers, the lower than 80. And that's the one I referenced that said no heat stress cases above this. About heat stress OSHA citations. The caution is mid-range between the NIOSH and National Weather Service and what I'm proposing. But notice that we start to get more conservative numbers as we move up than what I propose here. So again, an area that hasn't been rigorously cross-examined by others. So if you take care in pursuing that. And then, of course, because the National Weather Service does this, why don't we just have a heat index chart? Again, moderate work in the sun with regular clothing. And these would be that translation where you're looking at the air temperature and the relative humidity and then what the threat levels would be. In the PHS domain, acceptable is if the time limit's not exceeded and the predicted time is greater than 30 minutes. So in the PHS world, if the predicted time is under 30 minutes, it's simply unacceptable. That means that there is a significant heat storage problem. And then there's some room for some professional judgment, as the working group discussed in their last meeting, was you have to be careful about taking thresholds at a literal value. So the predicted limit's 38, but for instance, if it's 38.1 and you clearly have demonstrated an established steady state, then that probably is nonetheless an acceptable exposure. So with a bit more schooling and understanding in the nuances of PHS, there is some area for interpretation there about the level of risk. Then I'm just going to add some commentary on this assumption of risk. So when we start to go above the OEL, and I seem to be in some ways advocating that, I'm going to come back and couch that a bit. And again, this is a work in progress for me that I'm sharing with you, and feedback would be welcome. But first of all, let's talk about the risk inherent in the WBGT occupational exposure limit. First of all, the criterion are sustainable exposures. There have not been any rigorous studies that look at heat-related disorders or other deleterious outcomes to really explore what would be those heat stress limits where we have that kind of an outcome. And I really wouldn't want to speculate on where those will be. I used to think that they'd be higher. I'm beginning to think that these exposures are about right, but that's the level of gut versus science. These limits are based on healthy individuals. So there are clearly people in the general workforce that can't pass a physical exam to participate in a laboratory experiment. So I have provided in the handout material, and I'll remind you again a little later, that there's the kinds of chronic health conditions that ought to be a flag for affecting heat tolerance. And then there are acute health conditions that will also affect tolerance. And the acclimatization program, it's at present a tad bit aggressive. In other words, we don't assume that you're going to be fully acclimatized, but we think you're kind of pretty much there in 4 days. And when we talk about acclimatization, we'll talk a bit more about that. And then there's the other accepted risk that's inherent in individual heat stress management practices. How good are your practices are going to introduce risk. So the obligations then is with that assumption of risk that you should minimize those health outcomes. I think policy of self-determination with active engagement and supervision is important. Having a conservative low threshold for heat-related disorders is particularly important, with appropriate first aid and emergency response, and then a buddy system. You don't have people working alone. The policy on self-determination, if anybody's listened to me in other contexts, I consider that to be a hygiene practice. It should be a stated policy that encourages workers to break. There's a natural tendency for workers, new workers especially, to keep up with coworkers and show supervision at their team players. There are also work incentives that discourage breaks. One obvious work incentive is piecework. But the others are, I'm a probationary worker and I need to show them that I can do this. And so the other part of this is that there should be an active querying of individual workers about whether they need to take a break. All right. I'm going to start moving quickly through some other slides here. For acclimatization, this is where there's some nuances in approach that I'm still trying to iron out. The clear physiological adjustments that increase heat tolerances, an earlier onset of sweating, higher rate of sweat evaporation, sweat production for evaporative cooling, and better electrolyte management, which gives lower cardiovascular strain and lower body temperature. So the imputed importance is that, first of all, it's an unequivocal improvement in heat tolerance. There are a lot of case reports and OSHA citations that indicate that these heat illnesses are occurring in the first few days, and that there's an absence of a formal acclimatization program. And I don't argue with those observations, but I think that the question isn't quite so obvious, is that it really may not be the fact that it's a lack of acclimatization program and the workers are unacclimatized, but really a more complex kind of situation of low tolerance due to acclimatization state, an informal program, recognizing acclimatization, personal risk factors, and employment conditions. And we've referred to those. But I'll give you the obligatory schedules for acclimatization, and experienced workers ramp up over a period of 4 days. The new worker is a kind of holdover from the old industrial practices where new workers were also learning a new complex and dangerous job. So the theory was that they had to be ramped up more slowly. I think for relatively unskilled jobs, of which I've been now seeing a lot of these, is that they would be adequately protected by a higher ramp up. Reacclimatization just recognizes that if you're away for vacation or assigned to cooler work versus an illness, you're going to lose your acclimatization at different rates. We indicate 3 weeks here. There are a lot of studies that indicate that loss of acclimatization might even be slower than 3 weeks, but 3 weeks is a reasonable protective thought. So acclimatization versus the WBGT-OEL, 90% of unacclimatized healthy workers should exhibit a sustainable exposure at the OEL. That means that acclimatization, if you're working at the OEL, is going to be beneficial to 10%. The other is it's hard to know who is unacclimatized. In other words, what really was their previous history? What is their state? As opposed to knowing that they haven't been explicitly acclimatized under your watchful eye. And those are really two different issues. And then acclimatization protocols, we and a lot of people use a hot-dry condition, which has a WBGT of 36. And we find that most of our participants after 5 days can reach a sustainable, acceptable exposure for a 2-hour period of time. So it's not quite an 8-hour, but it really says that these acclimatization protocols are driving them much harder than the real world is driving them. We have also used a less hot and dry acclimatization protocol, which is a couple of degrees above an OEL. And we find that most of our participants come into that acclimatization program and don't show very much improvement over the days, which means they are being stressed at a level at which they find sustainable. So, the acclimatization, it can be then a bit more murky. So again, an acclimatization policy is helpful, and that the action limit or the recommended alert limit is a threshold for unacclimatized worker. That's the whole rationale for establishing that. But more so, it's a trigger point, because what you're trying to do with acclimatization is manage their transition, and by increasing their heat tolerance so you can get them up safely to the OEL. This leads me to suspect, and I'm not yet quite there prescribing it to people I consult with, less reliance on fixed schedules and more reliance on allowances for new and returning workers, that you just ramp them up more slowly. And for a few people that I've worked with, they clearly take new workers or returning workers and give them less demanding work. So there's an intuitive feel for how you can bring them along. I think it needs to be more formalized. And then, of course, it requires active supervision and employee participation. And then I want to wrap up in the last few minutes with the fact that we need to be able to recognize and apply proper first aid for exertional heat-related disorders. And I've in material you'll be able to download is one stab at a exertional heat illness response guide, and I'm going to kind of walk you through that. The decisions on clinical treatment, I think, are pretty nailed down among those I talk with. I took this past NIOSH, and they again feel that it maybe is a little bit more aggressive than they're comfortable with. But what's important about the recognition and treatment is that part of this kind of assumed risk, even using the OEL, there are going to be people who have a lower heat tolerance that aren't going to be sufficiently protected by the OEL. So the question becomes OEL. So when all else fails, we need to be able to pick those people up. And so heat stroke, which is the thing that we ought to fear, is, first of all, it may emerge as severe fatigue and nausea and vomiting. So not always, but it can. And really, if it's just fatigue and nausea and vomiting, that's what we would call severe heat exhaustion, and you ought to start treating it as that. And then start looking for any of these other signs. And erratic and irritable behavior, I've seen a number of case studies where people quit on the job and leave. And so the Bernard rule is, if somebody quits on the job, don't let them out of your sight. You've got a heat stroke coming. Confusion and disorientation. And again, I've seen this repeatedly where people just kind of don't know where they, literally don't know where they are. They talk and you can't understand what they have to say. And of course, if they collapse and go into convulsions or they're unconscious, you've got a heat stroke. You've got to believe anyways you have one. And in those cases, you begin very aggressive cooling, and ideally you cover them in ice or you place them in an ice water bath. And then if that's not available, whatever else you have that, throw in the kitchen sink at it, whatever you have to cool that person down, you need to do it. You need to do it then. And then you call emergency service, advise them that they probably have a heat stroke case, so they come properly prepared. And then for people who work out in the field, if you're going to call emergency services, you better know where to send them. Then severe heat exhaustion are things that you may see are very unstable walking, very slow reaction times. You'll see where people are just dragging. They may have muscle cramps, and there's no, when somebody has muscle cramps, you won't miss seeing it. And then we mentioned the vomiting or collapse without any signs of heat stroke. And then, and by the way, in heat stroke, there are no symptoms. Nobody's going to come up and tell you that they're having a heat stroke. In heat exhaustion, you may get them reporting to you that are really fatigued. And then if they start reporting loss of appetite and nausea, headache, and blurred vision, you've got to be very concerned. And I ought to probably move that up to observe, but if you see them skipping lunch or just picking at lunch, those are clues that there's a problem. Move to an air-conditioned space. Again, you want to cool them down, provide fluid replacement, electrolyte drink if available. The trick that the sports people have taught me is that you cover the head and shoulder in a towel soaked in ice water. That helps to differentiate between a severe heat exhaustion and not, because that will help them to recover in this 15-minute interval better. It's that first 15 minutes. So it's not a treatment so much as it'll help you make a distinction about whether you're looking at severe heat exhaustion or something that might be moving to a stroke. And of course, look for signs of heat stroke. If this doesn't improve in 15 minutes, you ought to, even if you're not seeing heat stroke, you ought to send them for medical treatment and then also continue to watch for heat stroke. Then with more mild heat exhaustion, this is going to be a symptoms driven. You're not going to see it so much as people will report. Again, inform the supervisor. This is part of that policy of self-determination, recovery in a cool area, and drink water, electrolyte. If symptoms persist, again, these should be very reversible. So if the symptoms aren't reversing in 15 minutes, then you ought to begin up that ante a bit and begin to treat it as a severe heat exhaustion and be a little bit more aggressive. Other heat-related disorders are fainting and cramps and heat rashes. They're important to know, less life-threatening. It's important to act early and err to the side of making a mistake. That the mistake is to identify and start to treat a disorder that's not there. Heat stroke management depends upon early recognition of signs. Again, the buddy system is argued there, and knowing when to treat that as a heat stroke. And then at any time a worker experiences a fainting spell, they should have medical approval before returning to work. This again is the clinicians I work with say, yes, but it might not be heat related at all. They may have an underlying medical condition that needs attention. So with that, I really appreciate the organizers of the seminar, the Northern California ERC and Michelle, appreciate that. And I will take questions.
Excellent. Thank you so much for your presentation. We do have a lot of questions that are coming in. As a reminder, you can enter your questions into the online chat, or I'm sorry, the online Q&A box, and I'll read them aloud to our presenter. One of the first questions we have here is, for the unsustainable exposures, can typical control measures, e.g. shade, water, rest, be implemented to allow workers to handle unsustainable exposures? Is there a period of time that workers can be exposed to those unsustainable exposures?
Okay, so two questions. Is for sustainable exposures, you know, the water rest shade campaign is appropriate, and it helps with the heat tolerance, but by definition that exposure is sustainable. For unsustainable, so you're a little bit above the TLV, and that shade and that rest, and the rest is more important than the shade, helps bring you back down to the OEL. That's really what it's about. When you're in a clearly unsustainable exposure, I recommend, and where I would go is a model that recognizes what a time limit may be and assure yourself that you're staying below those time limits, but then allow the fact that adequate recovery may take up to an hour before going back and doing that again.
Thank you. We also have another question. Can you discuss if altitude introduces additional risk factors for heat stress?
Yeah, I'm not as schooled with altitude to say anything. but I do view that with altitude, if you're acclimatizing to altitude, you're going to have similar cardiovascular demands that you will with heat, and there will be a competition. But for other kinds of concerns about altitude, I don't know.
Thank you. And have your studies included a minimum fluid intake?
Yes, so we always let them drink as much as they want, and we encourage it. So they're given a container of their choice of an electrolyte drink or water, cool, at their, we walk them on a treadmill, so it just sits on their treadmill.
Thank you. Also, is skin temperature a good indicator of heat stress?
I'm sorry?
Is skin temperature a good indicator of heat stress?
I think for this venue, I'm going to say no. So I think with more time to elaborate, the answer could be possibly yes, but no.
Thank you. And how quickly should someone transition from heat exhaustion to a heat stroke?
It can happen quickly. Sometimes heat exhaustions are self-limiting, but sometimes they aren't. Right? So in some regards, we pray for heat exhaustion because that'll keep somebody from the heat stroke regime. But if you have some kind of intolerance, all it is you're passing through exhaustion on the way to stroke, and you don't know which one you're dealing with.
Right. Kind of ties into the next question. Many ERs and EEs are hesitant to call emergency medical services immediately. Do you have any suggestions on how long someone should provide first aid, cooling in the shade, hydration, before calling EMS when a worker exhibits signs of mild heat exhaustion, for example, headache, excessive sweating, etc.? Is 15 minutes a good recommendation?
The 15 minutes is what I think I thought I wrote it in there actually, but yeah, 15 minutes is good, because if they're recovering in 15 minutes, you've got a very reversible one. If you have a severe heat exhaustion, and again, it resolves quickly, you might not want to send them back quite as fast, but they are likely to recover and go on. The severe heat exhaustions, if they're not adequately recovered, may show back up as a heat exhaustion soon. You need to keep your eye on them. Severe heat exhaustions that don't resolve in 15 minutes, you ought to call EMS. That really is a prudent course. And obviously, if you have a heat stroke, you gotta call.
Thank you. And we also have a question comment. My understanding is that you don't want to put a person in an ice bath when experiencing heat stroke because of concerns about causing organ failure. Is that not the case?
Yes, so it's shock is what the original fear was. You don't do it, you're going to cause organ failure. The literature now is very, very clear that the ice water immersion is the best and most recommended way of doing it. I mean, it's just unequivocally clear. There used to be a concern that's gone. That concern's gone.
Great, thank you. We do have a lot of questions coming in. As a reminder, if you could paste your questions into the online Q&A rather than the chat, that'll make sure that they don't get lost in the chat box. Thank you. We also have a question on if there are other pre-existing conditions that might put individuals at a higher risk.
Yes, so there's acute illness, which that I mentioned just in passing. Then there are more chronic illnesses, and that's the reason why I have given the medical exam criteria. So it's anything that's going to have an impact on some organ system responsible for thermal regulation. So which is just about every part of the body. And then in that is a list of drugs, prescription drugs, recreational drugs, OTCs, herbs.
Great, thank you. And what are any adjustments for persons with a history of CHD or with hypertension, if any?
Yeah, there aren't any prescriptive limits. So, so the advice we give is that they ought to work with their personal care provider. They should know that they work in a hot environment and follow the advice of their healthcare provider.
Great, thank you. And we do have time for just a couple more questions. If we didn't get to your question today, I do apologize, but perhaps you can send some follow-up emails and we can see what we might be able to get answered for you. Another question is, should direct supervisors be trained on how to identify signs of heat stress?
Yeah, absolutely.
Great. Just wanted to make sure we said yes.
Yeah, and that's part of the reason why I included that other handout sheet. So it's it's a cheat sheet that could be, available to the supervisor, however you do train. Yeah, absolutely.
Great, thank you. And do you have any recommendations on indoor heat illness prevention?
It's similar.
Great. Well, thank you so much today for this excellent presentation, and thank you to everyone who joined us and for all of these wonderful questions. The Education and Research Center Industrial Hygiene webinar series takes place the second Tuesday of each month. And this series is in addition to our ERC Ergonomics webinar series, which is the third Wednesday of each month. Our next industrial hygiene themed webinar will be on Tuesday, November 10th with Dr. John Reichart on biomonitoring and risk assessment, essential concepts and emerging technology. And that is in partnership with the University of Cincinnati ERC. You can check out our website for more information and to register for upcoming events. And that is coeh@berkeley.edu/aboutce. As a reminder, you'll receive an email tomorrow with a link to the evaluation. And you can also visit our website for this presentation recording, a PDF of presentation slides, and the additional resources mentioned by Dr. Bernard. Thank you all so much for joining us today. We appreciate you being here. Thank you for a wonderful presentation.